moods, and lady truths. We're here to talk, no shame, no sleuths. Laugh, learn, and feel empowered. Your body talk, uncensored and flowered. Let's talk titties and kitties. Smart, sassy, and totally gritty.
Hello, ladies, and hopefully some gentlemen. Welcome to the first episode of Let's Talk Titties and Kitties, the channel where we can actually talk about our bodies and what's happening to them and address kind of some of the common questions that people don't feel comfortable asking or don't even know they should ask because they just feel like it's normal. So I'm going to go over the legal disclaimer you just saw in the opening, just so we're clear. This channel is for general knowledge and informational purposes only. It should not be used to diagnose, treat, or prevent any medical condition. Consult with your medical professional for any health concerns or before making any changes to your health regimen. Okay, so what does that mean? That means while I am a medical professional, I am not your medical professional. So if you have any medications you need to change, you think you have a condition, you have a problem that you think needs addressed, it needs to be addressed by your provider or a provider near you. Do not take what I'm saying here and this as medical advice tailored to you because everybody is different and we should not just be treating everyone the same. So what I want to throw out there is I have never done anything like this before. This is totally new for me and I'm trying not to do it as a scripted thing. I don't want you to feel like there's no room for error or we can't have fun. So that being said, I do have probably a bit of undiagnosed ADD. So I have some notes. So if every once in a while I pause and have to look at my notes, it's just because I'm trying to keep myself on track. So for this first episode, what I want to do is basically go over your anatomy. Let's talk about lady bits because frankly, we don't talk about them enough. We don't know the proper terms. We know a whole bunch of slang and a whole bunch of baby words that we call them because nobody wants to tell their 5-year-old that the word they're looking for is vagina. They'd much rather just say your hoo-ha or your lady parts or your secret place. But as women, we need to be educated. We need to know what's going on with our body. And while it has to be age appropriate, it also needs to be taught. If you're not going to teach it when they're younger, that's fine. You do what's comfortable. But you also have to then teach it when they're older so that they know what their body is, what their parts are, and they're not afraid or ashamed to ask questions about it. So let's start with the outside parts, or the vulva, or some people call them the lips. So the labia majora and the labia minora, or the lips, protect everything that's inside. So what's next? The clitoris, or our fun button, as we like to call it. So it's that little thing that sometimes seems hard for people to find, but it's right there at the top of the labia, where the labia majora and minora meet at the top. And that's that super sensitive spot that is all about pleasure. What's next? The vaginal opening. That's where the menstrual blood comes from. That's where you have penetrative intercourse. That's where you use tampons, and that is where the baby comes out when you give birth. Now, the last thing in there is the urethra. That's that tiny little hole you pee from, and yes, it is separate from your vaginal opening. So here is a diagram that shows the outer anatomy of the female body. Okay, so let's move to the interior. The vagina, that's that long stretchy tube that connects the outside world to the uterus. It's where sex happens, it's where your period flow comes from, and that's the passage that babies go through when they're born. At the top of that is your cervix. It's a soft little nub that is the doorway between the vagina and the uterus. It opens during childbirth so the baby can be born, and it opens a little bit to allow menstrual blood to come out. So next is the uterus. It's about the size of a fist. It's a pear-shaped organ. That's where the babies grow. If there's no baby, the lining that builds up every month sheds, and that's what your period is. Next are the ovaries. They're 2 little glands that release eggs and make the hormones for your female reproductive tract, like estrogen. Then there are fallopian tubes. They're the highways that the eggs travel to get to the uterus. If a sperm meets the egg there, that's how you get pregnant. And then that embryo travels down into the uterus for implantation. That's how you get pregnant. So your body is amazing, and knowing how it works is powerful. So whether you're dealing with periods, planning for a pregnancy, or really just want to know what's going on down there, understanding your anatomy is basic step one and is so important. So stay tuned for more episodes where we dive in a little deeper into each part and answer some questions. Feel free to list some questions below that you want addressed, and I can address them in a future episode. And don't forget to subscribe and share, because talking about our bodies shouldn't be taboo. So see you next time on Let's Talk Titties and Kitties.